and improve their appearance in a real way. And at the end, I'll reveal product number 5 that revitalizes nails in just 12 hours. Now let's talk about the first product that I consider truly useful when nails are weak, split easily, or start to look dull and fragile. And although many people overlook this ingredient, the truth is that it can make an enormous difference. A cream with urea in the proper concentration. But here's something important you need to know from the beginning. Many people hear the word urea and think only about hydration, as if it were just another ordinary cream. However, in dermatology, urea has a much more interesting role, especially when we talk about damaged nails. Why? Because nails do not weaken only from lack of water. And this detail completely changes the way we should care for them. Over time, constant contact with detergents, frequent use of nail polish, harsh removers, cleaning products, and even small daily traumas cause the nail structure to become altered. Keratin starts to become disorganized. Then the nail loses elasticity, becomes rigid, peels in layers, or starts breaking as soon as it grows a little. And this is where urea becomes so interesting. When used in concentrations of 20%, it not only helps attract and retain water inside the nail, but it also helps soften and reorganize that altered keratin. In other words, it does not act only on the surface to give the appearance of hydration. It helps improve the quality of the nail from a much deeper perspective. And here comes something that very few people know. Urea is also used in specific dermatological treatments because it has the ability to facilitate the penetration of certain medications into the nail, especially in some cases related to fungus. This means we are not talking about a homemade ingredient or something simply cosmetic. It is an active ingredient widely used in dermatology because of its ability to improve the condition of the nail in a real way. The best way to apply it? Ideally at night, because that is when the hands rest and the product can stay working longer without constant washing. You only need a small amount. Apply it over the entire surface of the nail and also around the cuticle, because that area greatly influences the healthy growth of the new nail. Then gently massage for a few seconds. And although it may seem like a minor detail, that massage helps a lot because it improves the distribution of the product and promotes hydration in the area. And here, I'll leave you with an extra tip that can greatly enhance the results. After applying the cream, try not to wash your hands immediately or touch cleaning products. The longer the urea remains in contact with the nail, the better it can work. Also, if your nails are extremely fragile, try to wear gloves when washing dishes or handling detergents, because many times the problem is not only a lack of treatment, but the constant damage we expose our nails to every single day without realizing it. Before continuing with the second product, write the word healthy nails if you commit to taking care of them starting today. Good. The second product that I consider essential for restoring weak nails is oils rich in physiological lipids. And here, I want to explain something that many people do not know, because understanding this completely changes the way you begin caring for your nails. Unlike the skin, nails do not produce natural oil on their own. They do not have sebaceous glands capable of keeping them lubricated or protected automatically. And that means they depend almost entirely on external care to remain flexible, resistant, and healthy. And what happens when that protection is missing for weeks or months? Little by little, the nail starts to deteriorate. First, it loses shine. Then, it feels rougher and more rigid. Later, those small layers that lift at the tip begin to appear, side cracks, or the feeling that the nail breaks with anything. And here comes something important. Many people believe their nails are weak only because they lack vitamins. But in many cases, the main problem is much simpler. The nail is completely unprotected and dehydrated every single day. That is why the right oils can help so much. Oils such as jojoba, almond, or vitamin E provide lipids that help restore the lubrication that the nail cannot generate on its own. And this is key, because when a nail is properly lubricated, it becomes more flexible and better withstands small daily movements and impacts without breaking easily. But here is a detail that almost nobody takes into account. And honestly, it is one of the most important parts of nail care. The cuticle. Many people have the habit of constantly cutting it because they think it only gets in the way or looks unattractive. However, the cuticle functions as a natural protective barrier. It is literally a kind of seal that protects the area where the new nail grows from. And what happens when that barrier gets damaged over and over again? Hangnails, irritation, burning, inflammation, and even infections around the nail start to appear. In fact, many people live with pain in that area without realizing that the problem is not actually in the nail itself, but in a completely mistreated cuticle. And here, oils fulfill another huge function. They do not only improve the appearance of the nail, they also help keep the cuticle flexible, hydrated, and resistant, preventing it from drying out and constantly breaking. I remember the case of a patient who came in very worried because she had hangnails all the time. She told me, "Doctor, I always have pain around my nails, and I feel like they never heal." She thought she probably had a vitamin deficiency or some more complex problem. But when we examined her hands, the real problem was obvious. The cuticle was extremely damaged from the constant use of removers, harsh soaps, and the habit of pulling small bits of skin with her fingers. I recommended something very simple: applying oil daily, especially at night, massaging not only the nail but also the entire surrounding area. And honestly, the change was much faster than I expected. And this leaves a very important lesson. Many times you do not need complicated routines or expensive products to notice a real improvement. Sometimes, the biggest changes come from simple habits that we do consistently. Now then, for these oils to truly work, there is a correct way to use them. Ideally, apply a small amount over each nail and spend a few seconds gently massaging it. That massage helps distribute the product better and promotes the area's absorption of the lipids. In addition, it improves circulation around the nail matrix, which is where the new nail is formed. And if you want to enhance the results even more, you can apply the oil after washing your hands or before going to sleep, because at those times, the skin is usually more receptive to hydration. Another tip that can help you tremendously: avoid pulling hangnails with your fingers, because although it seems like something small, every time you pull that skin, you are creating a small injury that can become inflamed or even infected. Subscribe to the channel and activate the notification bell if you want more videos like this. The third product I want to talk to you about is nail hardeners, but here is a very important detail. Not just any hardener works. Because many times, people buy the strongest hardener thinking, if it hardens more, then my nails will stop breaking. But the reality is quite different. In fact, some nails actually start getting worse precisely because of using hardeners that are too aggressive. And this is where a very controversial ingredient comes in: formaldehyde. For many years, it was used in many traditional hardeners because it actually does make the nail feel harder almost immediately. The problem is that an excessively rigid nail is not always a healthy nail. When a hardener contains too much formaldehyde, the nail can become so rigid that it loses its natural elasticity. And then something curious happens. It seems stronger at first, but over time, it starts breaking more easily, especially at the edges or in areas where it receives constant pressure. In addition, in some people, these products can cause irritation, sensitivity, or even dryness around the nail and the cuticle. And obviously, that ends up making the problem even worse. That is why nowadays the most modern hardeners aim for something completely different. They no longer try to turn the nail into a rigid and hard surface like stone. What they seek is to strengthen it while maintaining a certain degree of natural flexibility. And this is exactly what you really need: a resistant nail, yes, but one that can also bend slightly without breaking. Because many people focus only on hardening the nails, when in reality, the goal should be to balance strength and hydration at the same time. In fact, here is something that almost nobody mentions. A nail that is too soft can break, but a nail that is too hard can also break. balance is what makes the difference. Tell me in the comments what is the problem you notice the most in your nails. I will be responding to all your questions. The fourth product I want to talk to you about is topical antifungals, but only when they are truly necessary. And here, I want to pause for a moment because this topic creates a lot of confusion. Many people spend years with yellow, thick, brittle, or deformed nails thinking that simply their nails are like that. Some even try to constantly hide them with nail polish because they believe it is only an aesthetic problem. But in many cases, we are not talking about a simple appearance issue. We are talking about a fungal infection, medically known as onychomycosis. And honestly, it is much more common than most people imagine. In fact, many people live with nail fungus for years without realizing it, because at first the changes are usually small. Maybe a yellowish spot appears in one corner, or the nail starts looking a little duller. Then it begins to thicken, break easily, or slightly separate. And here is the problem. Since the process is usually slow, many people normalize it. They think it is age, nail polish, humidity, or simply a damaged nail. But when the fungus progresses, the structure of the nail begins to deteriorate more and more. The nail can change color, becoming yellow, white, or even brown. It can become thicker and harder to cut. Sometimes material builds up underneath the nail, and that uncomfortable feeling of pressure or deformity appears. And in some cases, it can even cause pain when walking or wearing closed shoes. And here is something very important that I want you to remember. When there is a fungal infection, no cosmetic nail polish is going to solve the real problem. It may hide it for a while, yes, but the fungus is still there underneath, slowly progressing. That is why, when onychomycosis truly exists, topical antifungals can be a very useful tool. Ingredients such as cyclopyrox or amorolfine have clinical support and are specifically designed to fight fungal growth inside the nail. And how do they work? Basically, they alter the structure and metabolism of the fungus, making it difficult for it to continue growing and spreading. But here comes a fundamental part that many people do not understand. These treatments require patience. A lot of patience. There are people who apply the antifungal for 2 or 3 weeks, look at the nail and say, it's still yellow. Of course, because the diseased nail is still there. What you should observe is whether a cleaner and healthier area starts growing from the root. That is the true sign of improvement. Now then, it is also important to understand that not all yellow nails have fungus, and this is key. Some alterations may be due to trauma, psoriasis, aging, very dark nail polish, or even other dermatological problems. That is why, when a nail changes color significantly, becomes too thick, or has been deteriorating for a long time, the most advisable thing is to have a proper evaluation before starting any treatment. The fifth product I want to talk to you about is strengtheners with biotin and keratin. And here I want to clarify something from the beginning, because there is a lot of confusing information surrounding this topic. These products can help improve the superficial appearance of the nail, reduce brittleness, and provide support to the external structure. Keratin, for example, is the main protein that forms the nails. So some treatments seek to temporarily reinforce that structure, so the nail feels more resistant and less prone to breaking. And although they do not perform miracles, they can still be useful as part of a consistent care routine. But here comes the really important part. And honestly, many times, this is the true origin of the problem. Nails do not depend only on what you apply externally. They also reflect a lot of what is happening inside the body. In fact, when a person has extremely fragile nails, very slow growth, marked lines, constant peeling, or persistent deformities, many times the body is trying to send a signal that something is not functioning properly internally. And here, nutrition plays an enormous role. Deficiencies in iron, zinc, proteins, vitamin B12, or even very restrictive diets can directly affect the quality of the nails. Because in the end, the nail needs nutrients in order to grow strong and maintain a healthy structure. For example, When there is an iron deficiency, the nails may begin to weaken, lose resistance, or even change shape. Some people develop concave nails, known as spoon nails, which can be related to iron deficiency over a long period of time. And here, I want to pause, because this is very important. Nails do not speak only about aesthetics. Many times they speak about health. In fact, in dermatology, nails can function as an authentic diagnostic tool. There are small changes that seem insignificant, but that can provide important clues about what is happening in the body. For example, Bow's lines, those horizontal indentations that cross the nail, can appear after severe illnesses, high fever, intense stress, or situations where the body suffered a major impact. Basically, it is as if the growth of the nail had been temporarily paused, and many people do not even relate one thing to the other. There are also color changes that can indicate infections, circulatory problems, or dermatological alterations that need attention. Even nails that separate easily or suddenly change texture can be signs that something else is happening. That is why, when changes in the nails are persistent, progressive, or appear suddenly without a clear explanation, the smartest thing is not simply to cover them with nail polish or try 20 different products. The most important thing is to investigate the cause. Share this video on WhatsApp with that person who is always complaining about weak, brittle, or damaged nails. Discover the 3-minute Vaseline trick that revitalizes the skin. Click here. See you in the next video.